Hey everyone, this is going to be video 5 spirometry for Victoria Novak. I've showed you in my previous videos the bedside spirometer and what it looks like and how it works. It works just like in the PFT. You calibrate it with a 3-liter syringe. Here's the calibration port with a flow sensor. You hook in the mouthpiece here on the end, which also has a filter. You have to instruct that patient to close the teeth and then the lips tightly around the mouthpiece. You're going to ask your patient that series of questions to make sure that they're going to be able to be at their respiratory baseline before the testing. You measure height, weight, gender, and room temperature. So I have just a couple of little notes. So we calibrate the machine between every patient. You have to make sure that you zero the flow. So at my facility, they do the 4 tests. They do slow vital capacity, forced vital capacity, pleth, and then the Delco for complete. Then they do the albuterol, wait that allotted time, and then they go back and they repeat all the tests but the Delco. So for the Delco, the door is open. For the pleth, the door is closed, and that's the short, shallow panting. So when you do PFTs, you really need to be a good coach for your patient. By coaching your patient properly, you're going to help them to achieve the best values. And so that really is your biggest job. You want to make sure that your patient's wearing their little nose clips so that they aren't leaking any air. And you want to make sure that they're giving their lungs the ability to inflate and work properly. So you need them to sit up nice and tall, feet flat on the floor. You don't want them slouching, you don't want them cross-legged. You want them to be in that optimal sitting position. So to coach slow vital capacity, you're doing those normal tidal volumes. Then you want them to take a deep breath in, and you want them to breathe in as much as they can until they have their lungs completely full. Once their lungs are completely full, you want them to slowly breathe out all that air, and you want them to breathe it out until they can't breathe out anymore, and then they'll take that breath in. So when you're coaching for that, you want to say, keep breathing in, in until you can't breathe in anymore, and then when you can't, I want you to slowly exhale, and I want you to blow, and blow it all out, and you'll watch the screen. For the forced vital capacity, you're having them do the normal tidal volumes, then you're going to have them take that deep, fast breath in, blast it out. So here at my site, they like to get really involved. I think it's a good way to keep your patients' efforts up. So they'll say, okay, I want you to take the normal breathing, whatever, and then deep, fast breath in, and then blast it out. And they do the arm motions, and they say blow, keep going, and they really cheerlead, and then say, okay, now take that deep breath in once they have all the air out. Each of the tests that they do, they need to have 3 values that are within 5%. If they're doing a pre and a post, they want to have a 12% difference. So for the pleth, it's that they're inside the box. The box is closed, and you're having to do a short, shallow panting. Then they're going to have to pant against the little shutter. And so a lot of the proctors at my site will coach patients. If they've had babies, or if their wives have had babies, they'll say, remember when the doctor had your wife do the that's what I want you to do. And so they coach them through that. They pant, the shutter closes, they say, okay, keep panting, keep going, and eventually that was the end of that test. And then for the Delco test, they're in the box, but they have the door open, and that's where they actually have to like hold their breath. I think it's for 8 seconds, so you count down with them, and you have to calibrate the machine between every trial. So you have to stop, calibrate each time. So you have them breathe easy, and then you have them take a breath, blow it out, and then you have them breathe it in, 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 and you're having them hold it. And then you count down from 8 for them, and then they can blow it all out. And then you want them to blow, 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 blow until they can't blow anymore. So that's how the tests work here, and you just really try to make sure that you're a good coach for your patient.